Welcome to the Low Carb MD podcast. No one is beyond help. No one is beyond hope. Nothing said on the Low Carb MD podcast is medical advice. Please consult your own doctor before making any lifestyle changes.
Hello and welcome to the Low Carb MD podcast. Tro, we've outdone ourselves this time. I'm happy today.
Yeah, I'm happy to be here. I've had the pleasure of interacting with our guest for a number of years. I think it's going to be like 7 or 8 years we've been talking to each other, Cynthia, and I've been just so impressed with her rise. Her first book was absolutely amazing on intermittent fasting, and I'm excited about her new book. Today we have Cynthia Thurlow. She is a nurse practitioner. Her story of exiting the system is, I think, inspirational to many people out there, similar to our own journeys, Brian. And I'm just excited for her new book. I think it's something, Brian, you've been talking about, so kudos to you for bringing it up. And I know it's something that Cynthia Thurlow is passionate about and ready to talk about. Both the menopause and the gut. And I forgot the book in between, because you had there's three. This is the third book, right? If I'm mistaken.
This is I would say this is 2 published books, and then, in between were some, just kind of self-published books that, kind of iterating on things that were important to me at that time. But
don't discount it. You're I think, at this point I've seen you lecture nationally. You've got an amazing community. Gosh, my wife follows you and loves your content. So that's a plug. We're happy to have you here.
Oh, thanks, guys. I feel like I'm home with my people. I think that we're all people that lead with integrity and lead with our hearts, and ultimately we're impacting lives. However that happens. I feel so grateful that the intermittent fasting world brought me to both of you, and, we're all doing great work. So thanks for having me.
Yeah, thanks for joining us. And your new book, The Menopausal Gut, it's so important. When I saw that you're talking about this, I was like, you got to be kidding me. I saw you on social media doing that. And it was just it's such a topic that Tro and I have debated it, argued about it. People go, well, there's no data on that. I'm like, have you not looked? There's a ton of data. But the argument comes back hey, we don't know what to do about it anyway, so why worry about it? That's kind of the argument that I get from a lot of people, that are smart people, but they go, look, it's too yucky to talk about.
Yeah, well, I hear all the time it's not tangible, therefore it's not important. And I remind people, just because you can't see it doesn't mean it's not important. And I think the true irony is, life imitates art. I had a healthcare hiccup in 2018 into 2019. And when I started thinking about, what brought me to getting so sick and then looking at lots of diagnostic testing for female patients, I was like, oh my gosh, there's so much here. And we're so focused, importantly, on cardiovascular disease and bone health and, neurocognitive health. And yet there's a really important, probably undervalued and underappreciated part of our bodies that shifts dynamically relevant to hormonal fluctuations, neurotransmitters, other inputs. All of us talk about lifestyle as medicine, chronic antibiotic use. I mean, the microbiome tries to kind of stay, in a place where it's, heterogeneous or as helpful as it can be. But I think our modern day lifestyles are making it harder for our bodies to remain metabolically healthy. And, I feel grateful to be able to have a platform to be able to talk to this. Because I think, and I would say this to anyone, there's something called the microgenderome, and it really speaks to how our hormones influence the health of the microbiome. And, looking at the data, looking at the research, it's really quite extraordinary that we're all standing upright, to be honest with you. The more that I understand, the more I really feel like all these 40 trillion bacteria, viruses, fungi, and protozoa really interface with every organ system and cell in the body.
Let's go into it. Like we're talking about 100 trillion cells. So people listening, to put it in perspective, I think our national debt is like 37 trillion, and we're all screaming. And there's like over 100 trillion cells is 3 times the national debt is in your gut. And these
Yeah.
guys all play a role. So we can debate. And Cynthia, I'd love to hear your take on it, because William Davis, I love him. Everything he does.
Mhm.
I like what he's talking about, because he's in the same. He's talking the same language, and
Yeah.
he's going, look, I'm seeing cardiovascular disease in people with normal LDL. That can't be the only factor. There's other factors here, and he observed it, and he starts looking. He's like, how can these people eating wheat? He wrote Wheat Belly. He goes,
Mhm.
why is wheat a problem? There's no fat, there's no cholesterol. Oh, it can interfere with the gut lining. It could cause leaky gut. And people go, well, here's all these functional guys are going, look, we've known this for 30, 40 years. We've been talking about it. So how is it all of a sudden we start, now us Western docs are starting to look at that?
Yeah, it's interesting. I had the opportunity to connect with him on the podcast a few months ago, and he said, what's it with cardiology people like leaving to do lifestyle medicine and then kind of circumventing to looking more closely at the gut microbiome? I think for a lot of people, because it's not tangible, we assume it's irrelevant. And just to give listeners some perspective, when we're talking about the gut microbiome, we're speaking to the large intestine or the colon. And there's a lot of roles of the microbiome that probably go without real explanation or focus. Our immune system, metabolic health is focused in there, how we process specific hormones. There's something called the estrobolome that is so important about how women in particular package up and process our estrogen. And I think when people start to understand that there's important signaling molecules, things like butyrate that cross the blood-brain barrier that are derived from colonocytes and fermented fiber, it helps us understand like there is this complex communication system that originates from the gut microbiome. And yet, I think for the most part of my kind of clinical career, I didn't even think about this. I mean, I didn't care about fiber. I didn't think about fiber. I didn't think about the role of, chronic antibiotic use or the standard American diet and its impact vis-a-vis the gut microbiome. And yet now I look at it and it explains so much about the poor metabolic health that all of us are seeing collectively. And certainly over the past 25 years, we're not heading in the right direction. We're actually, well, some of us are, but the majority of Americans are still heading in the wrong direction. And I think our modern day lifestyles are contributing to an exacerbation in all of these poor effects that come out of this.
One of the things I was thinking, and I'd love to hear your opinion about this, is the fact that we may be the first generation ever to have to worry about processed carbs, processed oil, and we're the first generation ever. We knew sort of how to deal with and avoid heavy metals. We knew how to do that. But on the industrial scale that we're dealing with, the air pollution, water pollution, microplastics, antibiotics, this is a novel environment, and we were not engineered to deal with this, in my opinion. So, how do each one of these affect the microbiome? And I think leading back to more than just the microbiome, can you help me understand, what are the key life events, whether it could be vaccines, whether it could be childhood and breastfeeding, whether it's menopause, what are the key life events that have drastic changes on the microbiome? I'd love to hear your thoughts a little bit about that.
Thanks, Troy. I think I'm going to start with that first and talk about, at birth, whether we're a vaginal delivery or a C-section delivery, whether we are breastfed or formula fed, those things imprint the microbiome quite substantially. And I think I always say, like, we can't do anything about how we were delivered and how we were fed at the beginning of our lives, but we do have tremendous ability to impact and imprint what we do for the rest of our lives. I think when we look at three key times in a woman's life, and I would make an argument, men go through andropause not nearly as dramatic as menopause, but puberty as a time of dynamic shifts in terms of diversity, inflammation. Puberty is the first big P for women, and then pregnancy if women choose to become pregnant, and then not surprisingly, perimenopause. And the irony is that there are such dynamic shifts in diversity and inflammation and dysbiotic species that by the time a woman's in menopause, unless she's doing and making a great deal of changes, her microbiome will actually resemble a male's. So it's like life comes full circle. Young men and young women, until they go through puberty, their microbiomes are very similar. And then life comes full circle. But it's interesting, the research that I've read about men is that the andropause impact on the microbiome is so much less dramatic. I mean, it's kind of like everything else. Andropause is not nearly as dramatic as menopause, but it does happen. Those hormonal declines shift the microbiome dramatically. The other inputs that I think really make a big difference, how well you sleep, because we don't just have the suprachiasmatic nucleus is in our brain. We don't just have a brain center. We have circadian clocks throughout our digestive system. There's constant input to the brain throughout the body. So quality of sleep, how we manage our stress. There's a lot of evolving research looking at adverse childhood events, and I'm sure we can unpack the role of trauma imprinting and rewiring the autonomic nervous system and rewiring the way that our gut evolves and changes. Really looking at the role of nutrition, which I know is really important for all of us, how we've gotten so segued away from eating nutrient-dense foods to eating predominantly. I think the last statistic I read was 70% of us are consuming ultra-processed foods on the regular. It's not a every once in a while, it's the emulsifiers, it's the additives, it's the inflammatory seed oils, it's the sugars and the other junky lab creations that the processed food industry has deemed acceptable for us to consume. It's the lack of movement. Most people are not exercising or they're significantly sedentary throughout the day. As I'm sitting here in my office on my butt while I'm having this conversation, I try to not make that my norm. But for so many of us, all of these inputs have significant effects on the microbiome. So that's, one big hurdle. We have control of some things, but obviously not everything. Then you layer in the kind of complex interplay of these hormones. I think a great deal about estradiol is like this key hormone for women that imprints the microbiome significantly. And it's not just the interface of the estrobolome and everything else, it's also this complex interplay with the immune system. It's a potent immune modulatory hormone. I now know more about the immune system than I ever thought was possible. And the immune system is complicated. And it's helping people understand as these hormonal fluctuations are occurring, not just estradiol, we're seeing, why do women suddenly start experiencing more autoimmune conditions in perimenopause and menopause 4 to 5 times greater? Looking at, why we are seeing so much inflammatory changes in the body, not just achy joints, not just brain fog, etc. And then the other thing that I think is important, and you touched on, Tro, is microplastics. So we are inundated, even if we are observant and careful and conscientious about what we bring into our homes, we're exposed to microplastics everywhere we go. I mean, tap water doesn't filter these things out. Even if you have a good filter for your home, you are still exposed. And what many people do not realize is endocrine mimicking chemicals, whether it's microplastics or parabens, they actually interface with receptors of these hormones. And they, in some instances, can be 1,000 times more potent. So when a woman says to me, I'm in menopause, I know my estrogen is low. How is it possible that my body is interfacing with all these chemicals and yet my symptoms are suggestive of being estrogen dominant? And so it's kind of looking at this very layered, very nuanced conversation, understanding that it is never just one thing that is impacting us. And you start looking at, I think about 2 or 3 well-known celebrities that have recently died of colorectal cancer. And so I've been asking experts when they come on the podcast, why do you think this is happening? And the things that they mention are our bodies are being bombarded by toxins, the ultra-processed foods, the lack of fiber in the diet could be all contributing. Maybe it's slightly some epigenetic changes. Maybe it's, the chronic stress, the, not enough sleep, not enough physical activity, all these things coming together almost as if it's the perfect storm for why we're seeing all these alterations. So I think it's many things. And it sometimes feels overwhelming when patients or clients hear this information because they're like, wait a minute, I can't control everything. So what are the things I can control? And that's usually what we're working on. But it's also with greater awareness that if we think that our bodies can interface with all these artificial things and not have a negative net impact over time, I think we're being really foolish. And I appreciate that, at least in this group of us together, that we can have these conversations because traditional allopathic medicine still thinks it's bunk, that it's irrelevant in some instances, that some of these artificial fake foods and, you know, parabens, phthalates, all these chemicals we get exposed to, they can't possibly have long-term detrimental effects. So I think it's many, many things that are interfacing with our bodies and our microbiome. And our bodies aren't designed to be able to, weather this degree of exposure over time without some ill effects.
Yeah, and the interplay, people don't think about the interplay between, for instance, low progesterone lowers your butyrate levels, which is protecting your gut. And
Yep.
so people in ketogenic, I mean, that may actually, when you have more butyrate, raises progesterone levels. So they kind of play off each other. So you go, okay, you go through menopause. Why does your cardiac risk go up suddenly, right? You get more visceral fat, the way you're storing your fat, you lose the effects of estrogen, progesterone, and now you get more, instead of having fat hip and breasts, it's going to your gut. And so you go, oh, your inflammatory markers are going up, your visceral fat's going up, your LDL's going up, everything's getting screwed up. But no one seems to make this connection. And that's why I was so happy with you talking to William Davis too. And I go, what are the long, like when you go, I asked him in 22, I said, what's the long-term problem with carnivore diet? He goes, acromancy, I think is going to be a problem. He goes, I don't have data, but now I have data showing them, look, what you said was true 3 years ago. And
Yep.
so when you start seeing that, you go, gosh, because like when you said fiber, like that's the F word. That's
Well,
the F word in low carb. Like carnivore diet, you go, I'm pooping fine. I don't need fiber. Well, your gut
yep.
microbiome does. It
Well,
just does.
but here's the thing, like I'll give you an example, just a personal example. So I have a bad family history of colorectal cancer. So I've been screened for colonoscopies since my 30s. And had one in 2020 and one in 2025. New provider, had my old records, did my colonoscopy, and he said, I just looked at your old results and I want to talk to you. What have you done differently? And I said, I drastically increased my fiber intake. He said, every bit of minor inflammation, and it was minor, internal hemorrhoids, all these things, all gone. He's like, clearly, what you're doing is working. And you're right. I have been on podcasts where I've been told, do not bring up the word fiber, and it is the new F word. And I think even in the carnivore community, I've reminded them like we're not designed to have elimination diets forever. Like I think carnivore can be very therapeutic. When someone, I was in the hospital, I had 6 weeks of antibiotics, my gut was a disaster. I did really well with carnivore for about 9 months until I was really craving vegetables, to be totally transparent. But it took a long time for me to be able to tolerate the fiber. And when someone tells me they do not tolerate fiber, the first thing I think is, what's going on in your gut? Because you should be able to tolerate even a small degree of fiber. It really speaks to the composition of the gut microbiome. And to your point about Akkermansia, this amazing keystone bacteria, it's important for a lot of things. It's important for that mucin lining for the small intestine. It's important for endogenous GLP-1 regulation. And I know the GLP-1 drugs are changing the narrative and the conversation, but our bodies actually make GLP-1 endogenously. And I think a lot of people just don't realize that we're not designed. I mean, this is my personal feeling. Processed carbs are different. We are not designed to live in an environment where we have zero types of fiber. Like everyone listening may have a different fiber tolerance. Some of us tolerate some types more than others, and that's okay. But to say that you don't tolerate at all oftentimes speaks to something going on in the microbiome. And a lot of people don't want to hear that. They're like, I'm happy on my carnivore island, occasionally having honey. And I don't want, and I maybe occasionally some fruit, but I don't want to be told that what I'm doing isn't working long term.
How do you measure? Like, how would you, I got to be honest. The amount of I maybe eat greens maybe 3 times a week. I maybe have fruit maybe like twice, maybe 2 to 5 times a month. So how do I tell? How do I tell? Am I okay? Am I not okay? What do you do to determine? I'm so removed from it. And Brian, this goes to you too, because I know you're a little more focused on the gut. Educate me. Well, how do I tell if I'm off or not, or what? I mean, there's no calprotectin in my stool. I got that.
Good.
But what do in New York, I can't test myself for zonulin.
Yeah, well, I was gonna say, yeah,
Yeah.
New York is definitely one of the few states that makes it challenging. I mean, I think stool testing is helpful. Looking at, keystone bacteria, looking at, I like to look at, I use the term digestive fire with patients, but, looking, do we need digestive enzymes? How are we doing with breaking down fecal fat? We know estrogen plays a role with bile. So why are women suddenly dealing with, being fat malabsorbed, and why are they struggling with fat? I mean, I'm the one that has the conversation with a patient to say, when you poop, and then when you turn around and look at your stool, what does it look like? And they're like, I don't ever look at my poop. And I'm like, well, if it floats along the surface of the toilet, I'm sorry, I'm a nurse. We talk about these things. If it floats around the surface of the toilet, where it looks greasy, it could be a sign that you're not breaking down your fat. So how many patients are being told, like, you need this high fat diet, and they're just not absorbing? So I think looking at stool testing, I think looking at fatty acid testing, objectively, that's what I found to be helpful. And then just having very frank conversations. A lot of patients are embarrassed to talk about pooping, but I'm like, it is helpful to know what it looks like. Is it formed? Is it not formed? Do you have to struggle? Are you constipated? Now, constipation may mean something different to every patient. But I remind patients all the time that, when I was an ER nurse in my past life, you better believe we saw people that alternated depending on how much laxatives and stimulants they were taking, what their stool patterns were like. And so I think it's valuable information, Tro. But here's the thing, this is bio-individual. Like, your body and you feel good eating the way that you do. But I find for a lot of people that if they really lean into what makes their body feel good, me personally, and I'll just share this to be transparent, I do better with a lower fat diet, higher protein, higher carbs. That's what works for me. That might not work for someone else, but it's probably very likely guided by my own microbes. Like, there's research that demonstrates, some women, they go into perimenopause, menopause, they're frustrated with weight loss resistance. I get it. It is so unbelievably frustrating. And their best friend did really well with keto. So they'll do a ketogenic diet. But I think keto, sometimes people get wrong. They think it means a high fat diet. I'm like, no, no, it's not a high fat diet. It's a moderate protein diet, lower carbohydrate diet. And so they'll overdo it with butter and bacon and, I mean, all these kind of fattier foods, not realizing they're also more calorically dense. And they're like, why did I gain 10 pounds on keto? And I'm like, this could be your microbiome might be very different than your best friend. It could be that you were just calorically consuming more food than you even realized. And so I think many things kind of factor into that conversation.
Yeah, and for me, the thing that made me really start looking at the GI map is a test I generally do. Just because it's cheaper than a lot of the stuff out there, and it gives me a lot of information. You can look at patterns and you go, oh yeah, you're not making enough stomach acid, or you're making too much stomach acid. You got SIBO. You have a parasite, which I never see on that test for some reason. But I pick it up with other things. But there's so many factors involved. So the thing that really like got me concerned, because I would, because of my practice, I take care of a lot of carnivores, right? So I think it's the combination of being type A and carnivore that's a tough one, because most people are carnivore, but you go, you never eat anything. Well, I eat guacamole, I eat this, and so they're adding some things in, and those people do better. And so I've had some super type A people come and they go, I've been carnivore for 5 years, and they have C. difficile, C. difficile with minimal antibiotic use. Why? because your gut microbiome was so narrow. And
Mhm.
that's when I got concerned because I go, okay, what's Parkinson's? Narrow gut microbiome. What's dementia? Narrow gut microbiome. All these bad things have a narrow gut microbiome. So do I want to purposely have a narrow gut microbiome? It just doesn't make sense to me if you look at the big picture because I have carnivores that have A1Cs of 6.3, 6.4. We fix their gut, and now all of a sudden their A1C is 5.7 and their insulin drops in half. And you go, okay, that's the only change. They're still carnivore. They just added a little fiber, scoop here and there or whatever. So I think those things we can't be so dogmatic in a way where you go, okay, I'm getting diabetic, but it's just because like all these, there's no published studies, but everyone says, well, it's because your red blood cells live longer. That's why the A1C is going up. I'm like, BS. Why is your insulin going up then?
Yeah.
Well, because
Yeah.
your blood's sitting there longer. Doesn't make sense.
No, I think you bring up such a good point, and this is why I think rigid dogmatism becomes problematic. People will hold on to something that has worked for them, even if it's no longer working for them. And I use intermittent fasting as another like great example of this, that I have a lot of women in menopause that I have them stop fasting. I'm like 12 hours of digestive rest. Yeah, there's a time in your day that you should not be eating. But sometimes, doing what is going to drive more cortisol, more stress response is sometimes not the way to go about doing it. And I would say that when people are so rigidly dogmatic about nutrition and not open to the possibility that they may need to adjust and kind of take a step back, like if I ate as much protein as Gabrielle Lyon told me to eat, I probably wouldn't be doing as well as I am right now. I think we need to listen to our bodies if we're capable of that. And that's why, Brian, when you mentioned that one of your carnivore patients ate guacamole, I'm like, that's great. He's listening to his body. Clearly, his body needed probably some monounsaturated fat, probably needed, the carbohydrates. Like, I just start to think about why we sometimes discourage our patients from intuitively following like what their body is trying to tell them. And I recognize, that may vary based on the patient, but I think it's a really important and relevant discussion that we are allowed to change our minds. We are allowed to say this worked for this period of my life, and now I pivot a little bit and I try something different, and that works really well. But I think all of us will acknowledge that a nutrient dense whole foods diet is what we're advocating for. That might look a little different for everyone. Like I will be fully transparent and tell you that when I start explaining to women why fiber is so important as short chain fatty acid production is declining in the absence of those hormones, and I tell them all the things that short chain fatty acids do in their body, they're like, oh my gosh, this makes so much sense. I was like, I'm not saying to go from 10 grams of fiber to 40. You're probably going to be incredibly unhappy with me. It takes your microbiome a bit of time to adjust, but some is better than none in the absence of understanding that over time, fiber can be really important as we're getting older for sure.
We're missing a lot of those keystone
Bacteria.
microbiome that makes the short chain fatty acids. So if they're super low, it affects brain function, affects hunger signals, GLP-1s, mucus layer of the colon. So that's why I was fasting. Actually, I was just making yogurt and I was
Mhm.
looking at inulin and they go, look at all the studies on inulin. I'm like, this is crazy. They took menopausal women and all they did was add inulin to their diet and they lost weight and their sugars got better. You're like, they lost weight by taking more calories. They didn't change their diet or exercise.
Yep.
And they,
And
they
I,
kept it static. You go, why? It's not the calories in, calories out. It's not the insulin model necessarily. It's more saying, oh, you get more satiety. You're not as hungry all the time. Maybe
and
that's better
that's,
for you than being starving all
yeah.
the time.
Well,
I have people on carnivore diet and it shocks me because I go, you shouldn't be hungry. I'll go, oh, I could eat. Oh, Tro can say that. I can eat 12 steaks, sit there and eat 12 steaks. Like, that's not normal. What happens if you add some inulin and see what if that tampers that a little bit, possibly, you
well,
know?
I read that study. I was actually talking about it on Wednesday to a group of clinicians, and I was saying, here's the N of one beauty of that. Do you know how many people I know don't tolerate inulin or tolerate teeny tiny or PHGG, partially hydrogenated guar gum, teeny tiny doses? If I like Lily's dark chocolate, I'm going to use this example. Like if I'm going to have like a treat, if I eat a bite or two, oh my God, the inulin blows my gut up. I don't tolerate inulin very well, but it could very well be because I eat so much other fiber. It might not work, but most women, when they're doing diet recalls, they're not eating enough protein, and they're not eating anywhere near a decent amount of fiber at all. And I think it's because we've widgeted ourselves into whatever nutritional dogma we believed in 5 years ago. And many of us have struggled to pivot. Like I said, I've been on some podcasts where I've been forbidden to talk about fiber, which makes it hard when they ask, like, what are the changes that are actually happening to the gut microbiome with perimenopause and menopause? I'm like, well, your short chain fatty acid production goes down. And they're like, well, how do we fix it? Well, there's the word you asked me not to say, but actually what would be most effective is probably a bit of HRT and a bit of fiber. And so we get back to that conundrum constantly.
Well, it's funny that we're talking about this because I was on the low carb cruise and I knew what I was talking about, the gut microbiome. And like I'm listening, they have a panel of experts. Every expert's like, you don't need fiber, you don't need fiber, you don't need fiber. I poop fine. I haven't had fiber in 5 years. I poop fine. Well, it's not about how you're pooping. And they go, well, if you put, and the argument they're using is, well, if you put more stuff in the pipe, it's going to clog the pipe and you're going to be more constipated. Well, have you ever been on a water slide? Like if you have no water in the slide, it's not going to slide very well. So your short chain fatty acids are making that mucus layer. If you're missing the mucus layer of your colon, I think it's all going to come back to that.
Yep.
If you don't have these organisms doing what they're supposed to do and you try to take pills to replace it, your gut microbiome is going to do it. Like you have to eat a ton of butter to see what your lactobacillus can do and your Akkermansia can do to make these mucus layer of your colon. Plus they detox uric acid and all these histamines and all these other things that we're struggling with. And you go, maybe we should just feed those guys so they don't torture us.
Yeah. Well, my husband in 2024 had a little bit of a healthcare hiccup and ended up on 6 months of pretty intensive therapy. And when he was done, we went on a trip. And at this location where we were, it was a lot of protein, but a lot of plant-based material. And my husband every day was like, oh my gosh, it's like my stomach's upset. I don't feel good. And I was like, you were on heavy duty antibiotics for 6 months. You've decimated your gut microbiome. It doesn't know what to do with all this fiber. It became a running joke between the two of us. I was like, I'm eating all this stuff just fine. I said, but we need to do things to kind of bolster you back up. I think the statistic I read was 1 round of antibiotics can disrupt the microbiome for 18 to 24 months. One. So think about months and months and months. And sometimes it's appropriate. In his case, he had tuberculosis. He didn't have a choice. Yeah. In some instances, you have to take the antibiotics. But I think for a lot of people, it's understanding like we want to be doing things to foster the healthy bacteria. And I think you're right about the mucin, that Akkermansia is really important for that. And if it's not there, I mean, you breach that 1 cell layer thick in the small intestine, you leak food particles into your bloodstream, you trigger an immune response, you develop food sensitivities. When people literally give me a list of 5 things they can eat, I'm automatically thinking, oh my gosh, what's going on in your microbiome? That's not supposed to be that way. Our body is not meant to avoid every single potential inflammatory food. It's just, you've gotten yourself widgeted, whether it's, SIBO doesn't occur in a vacuum, SIFO doesn't occur in a vacuum. I can now look at, when I'm looking at a stool test, just depending on what I'm seeing, I can almost always diagnose SIBO just from particular pathogens that are, problematic. On GI map, looking at H. pylori, looking at a little bit of candida, if it shows up on a GI map, that's not a good sign, because that test doesn't do a great job picking that up. But I think for a lot of individuals, having the validation that sometimes life circumstances happen and we can kind of bolster whichever direction we need to go in after the fact to support the microbiome.
I'd love to discuss a case that I saw with you two and maybe play a little diagnostic game. And it's about the gut microbiome. And Brian, you're going to love this, and I don't know how long I'll hear "I told you so" after I say this case. But I had a case of a patient actually who had a pretty good diet, healthy quote unquote diet, and was found to have fatty liver. And the doctor, they saw elevated liver enzymes, otherwise pretty thin, like no weight issues really whatsoever, and didn't drink alcohol, right? Didn't drink alcohol. And she went to her standard doc in the box and was told you have to cut out all alcohol. So she really didn't drink alcohol, but she cut it all out, repeated the ultrasound, repeated the liver enzymes, still elevated. So comes to me, Brian, like, what the hell's going on here? Do I have to get even healthier with my diet? Do I have to get to, so we do some stool testing. Well, she doesn't take PPIs, so that was the first thing. I was like, are you on PPIs? No. Are you on any chronic antibiotics? When was the last antibiotic use? Nothing lately. So we ran some stool testing and no inflammation. So no fecal inflammation, so that's off the table. And but something came back positive. So I'm going to give you guys, you can each ask 2-3 questions, and let's just play a game and see who makes the diagnosis. So let's go. Fatty liver, elevated liver enzymes, some gut, some bloating in the gut.
I see dysbiosis with low akkermansia. Akkermansia, if it's low, way more likely to get fatty liver disease, diabetes, like you name it.
Yep. Well, I was going to say some degree of dysbiosis plus or minus a parasite, probably low digestive enzymes, maybe some steatocrit elevation. What was her calprotectin? Was that elevated?
It wasn't elevated. That's the first thing I thought was, okay, maybe it's a parasite, maybe it's something. So she definitely had overgrowth.
Yep.
A Saccharomyces species. And I looked it up. I'm like, what's going on here? And apparently they grow alcohol.
Oh, yeah, that makes sense.
So
yeah, they do. That's what they use for kombucha.
Yeah, aldehyde.
Right? So it was actually growing alcohol, and she had measurable ethanol levels in her blood.
That's wild.
Because I was like, there's no way it's the gut. And I checked the ethanol level. She had measurable ethanol levels in her blood. It wasn't like it wasn't 0.1, but it was there. It was not 0.
Wow.
Right? She got treated for that. She went strict carnivore, actually. Carbohydrate elimination. She did fluconazole. 3 weeks later, no ethanol.
Wow.
No,
but it goes to show you get overgrowth. So like the bloating is always always, unless it's like I wake up and I'm bloated, then I'm thinking something more serious. But it really speaks to the fact that microbiome is so delicate. I mean, is she menopausal or is she perimenopausal or is she younger?
She was perimenopausal, fit, really fit. Right. And I was, she was like, do I have to lose more weight? Am I thin on the outside and fat on the inside? Okay. And she had fatty liver. And it was, she doesn't drink alcohol. The gut was making alcohol.
That aldehyde
was giving her steatosis. Yep. Yeah. And her fatty liver eventually resolved.
Thank God. I mean, that's scary when you think about it. But like I don't think I've seen a stool study on a patient in the past 5 years that didn't have some degree of dysbiosis. Some of it's so significant that you're asking her, like, are you having any symptoms? No. I'm like, okay, well, that's a whole separate conversation. That's somebody who's clearly disconnected from their bodies, which is a whole separate conversation. That whole fight, flee, or fawn, people that are dissociated from how their body feels for a variety of different reasons, I think can speak to many things. And what a fascinating, Brian, have you seen that?
I never check ethanol levels. I've never, I'm looking for those bacteria in the stool, in the gut. And so that's interesting. The fatty liver. I saw
the species, looked it up, Brian.
So you wonder, Tro, because that study is still like makes my brain hurt a little bit. That one that they went on a high fat ketogenic diet and their fatty liver got better than on a low fat ketogenic diet. So maybe the fat is changing the gut microbiome complexity in the small body. And I think we're seeing enough data. Like, Tro, it kind of blew my mind too when we were talking to the researcher for the Charlie Foundation. And she goes, they do 2 years of a ketogenic diet. Their seizures go away. They liberalize their carbs. They're not in ketosis and they don't get seizures. And so the conclusion is it changed the gut microbiome. And there's another study that's coming out, like I happen to have a little privy to, with Verta looking at cancer treatment using a ketogenic diet, and they showed dramatic changes in improvements in the gut microbiome on the ketogenic diet. For people going through chemotherapy, and that it was a night and day difference. So, I haven't looked at the whole details of the study, but they go that was it changed significantly in a positive way. So, and then in menopause, you look at that, like you're talking, like Cynthia, you're talking about the autoimmune diseases going up. I did a little informal poll on Twitter, and I said, hey, if you're a functional medicine person, have you ever diagnosed someone with autoimmune disease that has a normal gut? And everyone's like, 41 years, never seen it. 16 years, 12 years, 9 years, never seen it. But it may be because all of us all have screwed up guts, but to what extent?
Yeah. Yeah. Well, I mean, it's interesting. So in 2019, I had 6 weeks of antibiotics and antifungals, and the statistics aren't great when you start to realize the net impact on the gut. But you know, not soon afterwards, another autoimmune thing picks up. I've had a couple, but all of them are quiescent. But I think it really speaks to the fact that autoimmunity is not destiny, meaning I think people can put things into remission with, lifestyle changes, but it has to be like a multi-pronged effect. It's not just 5 minutes of meditation. Like they actually have to put in the work if their autonomic nervous system is wired a certain way, or they've had multiple rounds of antibiotics. I think most people in our generation got multiple rounds of antibiotics and didn't even realize, like, all the times my kids got antibiotics for ear infections, and I didn't know any better back then. Now they're older.
Yeah, I mean it's in the water supply. I mean if you go even further down, it's
Well, the animals we're eating have antibiotics. Like they like a majority of the antibiotics are used on animals, right?
Yep. To keep them healthy. Or how about that
Or
Skittles
make them
truck?
gain weight.
Yes. Well, they do that. They give them grains before slaughter, but the whole Skittles truck, which someone interviewed me on a podcast, they didn't believe that was true. And I said, I think a lot of the Midwest conventionally raised farmers are using, like, what's a cheap way to fatten up animals prior to slaughter? Sugar. Like that makes a great deal of sense economically for them, but then we're ingesting the metabolically unhealthy animal, and then it just kind of perpetuates this chain.
Yeah, 100%. I just it's I think the beauty of the microbiome, it's an area that it's a like another variable that is very difficult to consider in a multi-pronged approach. Like I gave the example with the fatty liver. I mean, fatty liver could be due to a choline deficiency. It could be due to a vitamin E deficiency. It could not, maybe that's why high fat works. It could be due to high triglycerides, high sugar, and excessive sort of triglyceride production in the liver and steatosis in the liver. And it could be due to like hyperinsulinemia metabolics. It could be due to alcohol and ethanol. It could be due to something else making ethanol, which was the case that we and I think like that's where I've landed, at least so far. It's like when you think about things that you can't see but are there, right? And it's difficult to measure, right? And it's difficult to isolate. I mean, you could do 3 stool tests and maybe I wouldn't have seen that species, right? Like, but it's tough to imagine something where it takes a lot of conceptual thought and maybe medical imagination. And that's, even parasites are like that, right? I mean, how many times do we do an ovum parasite, it comes back negative, and yet we know, it's something is there, and the fat, the stools, clearly has an inflammatory component, and there's something going on, but we can't isolate it. We can't isolate it, or maybe it embedded or seeded, or who knows. And you think about chronic Lyme, it's the same thing, right? Or chronic infections of any kind, right?
Well, I think that we all have enough experience now. We say, you know what? If you're carnivore, you shouldn't have high triglycerides. You really
Yeah.
shouldn't have high triglycerides and a high insulin level and high A1C. It shouldn't be there. So I would pretty much say 100% of the time I've looked, it was leaky gut.
Mhm.
because that's the explanation. You have insulin resistance in the absence of eating sugar.
Or
so it's not just about the sugar.
Right? Or some inflammation that has nothing to do with macronutrient distribution, right? Like that's what you mean, right? It's like, I mean, you say the gut, but like it could be the gut but it's some other, right? Some other factor. Right? Yeah. I don't know.
Well, and I think it shows you like limitations. Like I picked up Giardia, and every normal test didn't pick it up. It took some special test for this microbiologist in New Mexico that my stool had to be sent off to, that they finally were like, yeah, you've got Giardia. I was like, thank you. But it goes to show you, to Tro's point, I mean, does it go latent? So then you can't you can't determine what's going on. I mean, I think some of these conventional labs are, I don't know if it's that they're not sensitive enough or they're, it's just so black and white. Like you either have it or you don't, but it's not looking to see the type of organism or what variant you might be experiencing. I think there's definitely limitations to kind of conventional testing.
Yeah, it's like what you're saying. There's limitations to test. So if I'm really concerned about parasites, the GI map is not, I have not once seen a parasite on GI map. Never seen it yet.
A couple. I've seen a few worms, which freaks everybody out. But by the time someone has parasites and worms, there's a whole lot of other things going on for sure.
So it's really the sensitivity of these tests. A lot of them, you go, I don't know, like for that specific thing, you just kind of look at, but clinically, like funny enough, Tro, I think I might have told you this story before, but when I was at my old practice, I go, man, I was telling my partner, I go, man, I swear I got Giardia. I haven't been to the lake. I haven't gone out of the country, but I feel like I have Giardia. And he's like, well, that's weird. You don't have any exposures. That's weird. So all of a sudden my wife calls me. She's like, honey, guess what? I go, what? She goes, your new puppy she was having diarrhea. Yeah, she has Giardia. And I was like, oh my gosh, the dog licked me and I got Giardia from the dog. Like you don't think about it. So, and that's the thing is in Western countries, we don't think about these things. And so doing volunteer work overseas, and one of the other ones that I'd love to tell is, I have a patient, she was trying to get her diabetes under control. So we're doing low carb keto with her and her sugars are getting better, but she had severe irritable bowel syndrome, like really bad. And, then I go, you haven't been talking about it all. I mean, she had to like plan her trips, like know where every bathroom was and everything, freak out, like stressed out all the time. And her twin sister had the same thing. And she goes, the weirdest thing is when we got COVID, our IBS went away. It cured it. I'm like, really? So I'm thinking of like, how can that happen? She goes, I go, your sister too? Yeah. I go, did you take anything for COVID? She goes, yeah, we took ivermectin. I was like, oh. And you're from Mexico City. Did you have bowel problems before you moved to the US? No, never. I go, did they treat you for parasites? Yeah, every year at school. We got the ivermectin or whatever pill they gave us, mebendazole or whatever they used. And she goes, yeah, once we moved here, they didn't do it. So she really what she had was a parasite that whole time. They both had parasites. But no one in US thinks like, oh, maybe it's a parasite that you have diarrhea and you have IBS so bad, right? Yeah. And then I was just looking at a review and it was saying that all cases of IBS is leaky gut. Like all of them that they've seen that they're reviewing, you go, okay, so maybe it's not just in your head, right? There's IBS, the inflammation in the nerves, and yeah, just wild. But I'll tell you, maybe to know someone different, but I have never seen a GI doc look at the gut microbiome.
I would say there's only a couple. I've interviewed a few on the podcast, but
unless they're functional medicine people or like they get it, right? But yeah, it's amazing.
Otherwise, it's, you have IBS. Let's do a low FODMAP diet, and that'll fix everything. And I'm like, maybe not.
Well, no. Brian, I don't think it's. I know what you mean. I would just qualify and say, they look at it from the infectious disease mindset, right? Like, looking for inflammation, like of doing a fecal leukocyte or looking for a C. diff, PCR or, looking for a stool culture, right? Like, I think the way they look at the microbiome is just a limited, it's the way I was taught, right? And the way we were taught, right? Where they're not looking at the microbiome like either of you two would. But we look at it, we don't, I don't think that we think of it as a potential variable that needs clinical consideration, right? Like it's
Well, I
not.
think the more you're around, you go, these fecal transplant. When I first started, I go, that's the dumbest thing I've ever heard. You take crap out of one person, put it in another person, that's going to do something. That's stupid. But then you look at the data and you go, oh my gosh, there's people whose dementia got better. There's people who lost weight. There's people who gained 80 pounds in a year, because they got an obese person's microbiome. Like that didn't change their, exercise levels and everything else. You go, man. So it does play a role. And so you go, gosh, these are things we have to look at. With autism, there's some great data from Dr. Sabine Hazen coming out, where they do fecal transplants and their autism starts improving. You go, gosh, how many of these things come back to the gut and you fix that problem? At least take that out of the equation and go, let's make it healthy. Well, I have a bad gut. So we know stress screws up the gut microbiome, but stress makes you more likely to smoke and drink alcohol too, right?
Yeah,
And those things screw up the gut microbiome. So how many, it's a cycle that we get ourselves into, when we're not healthy.
absolutely. Well, it's interesting with the fecal transplant. I was just reading the other day, they were saying that if someone has a history of depression, they actually will not use their stool for a fecal transplant, which just goes to show you that there must be some, I mean, obviously, mood disorders are influenced by many, many things, but down to the microbiome and really looking at, what's populating in terms of neurotransmitters and hormonal influx that influences depression and anxiety, which I thought was fascinating.
And it goes back and forth. Being depressed and anxious screws up your gut microbiome. So yeah, it's really wild. You go, which is
Oh,
first?
cortisol.
Yeah, so
Cortisol.
it's so interesting though. But I was convinced when I saw these studies. They did a study. They took these mice and they put half the mice over in like stress land where they're getting like lightning going off in the middle of the night and cats are chasing them and all that stuff. Over here, they're in Bob Marley listening to reggae music
Mhm.
and chilling on the beach, right? Then they bring them together and they give them this medicine that causes inflammatory bowel disease. The happy ones, none of them get it. The stressed out ones, all of them got it. And you go, oh my gosh. So then what they did is they took a healthy one and they took its gut microbiome, put it into a sick one, and it got healthy. And then they took the microbiome out of a sick one, and they put in a healthy one, and he got sick. And you go, okay, there's something there. That's pretty wild. That
It
you
is.
realize the effect of stress and like these, like you brought up earlier, these early childhood traumas and being in sympathetic overdrive all the time and high cortisol levels and like what's the impact of all these things on each other.
Yeah. Well, and I mean, how many women, Tro and Brian, I'm curious to hear your experiences, but how many women hold it together in their teens, 20s, and 30s? They get into perimenopause and the wheels fall off the proverbial bus because every compensatory strategy they had been using to stay focused, controlled, all of a sudden no longer works in the absence or fluctuations of hormones and neurotransmitters. I think that perimenopause for a lot of women, the dynamic shifts in that microbiome and how it shows up for them in terms of mental health and the effect of the vagus nerve transmitting information to the brain. I think that it's this kind of great awakening for individuals. Maybe not as, again, dramatic as what men go through, but I think for a lot of women, it further defines like what they want their lives to be like, or not, for that matter.
Yeah, and clinically we see that when women have a ton of food cravings or they can't sleep or they're stressed all the time, a little progesterone, they go, "Oh my gosh, I feel calm." But progesterone also raises butyrate levels. You're like, how much is the direct effect of that, or is the effect on the gut
Yeah, because
that's making a
butyrate,
difference? Like they
yeah,
impact each other.
yeah, because butyrate crosses the blood-brain barrier. I was trying to explain that to a non-clinician about how the brain is designed to be impermeable, and yet, these signaling molecules are so important. And I was like, and there's one in particular that crosses the blood-brain barrier, and they were like, oh, I'm like, oh yeah, there's a lot to butyrate beyond just eating butter. There's a lot of benefits for sure.
And you also have recipes in your book.
I do. I
Do you
do.
have any favorites? Like,
I think some of the fermented foods, because we worked really hard to ensure that we could make that accessible. I think people, when they think fermented foods, they're like, oh, you're just telling me to eat sauerkraut. I'm like, well, you can ferment just about anything. But I would say the fermented foods recipes, I think in particular, were helpful because even the woman that I hired, Beth Lipton, who did my first set of recipes, she got really creative. So I think that it'll give people an opportunity to try. And why are ferments so important? It's like you're already consuming food that is going to go on to confer so many benefits to the microbiome itself. And, it's like find a couple things that you like and try them out. Like I have coconut milk yogurt because I don't tolerate dairy very well, but I have ferments every day. There's always a small portion with every meal. You don't have to eat tons. And I think that's one of the common misconceptions. I like miso soup. It's become part of my like evening routine. I have that with some fermented plum paste. And I can never remember the technical word for fermented plum paste, but you can find it on Amazon. But another like really great way, like miso soup to me is like an easy thing I can do. Just sip something warm. There's so many different things you can do to support your health that don't have to be complicated. Like that's the point that we're, I think, all trying to make is we're not asking people to jump through 15 hoops. I'm not talking about bright, shiny objects, although I know people in the health and wellness industry love that stuff. But the basics really do have a tremendous net effect on the microbiome. And it's incredibly malleable. You can abuse your body for 40 years and turn a corner and start taking care of yourself, and your microbiome will adjust.
Yeah, it's wild. Like, I was just talking to Sabine Hazen. I was asking her, I go, you're in Hollywood, like you take care of all these rock stars, and like she goes, oh yeah, people who smoke pot and don't like it screws up their gut microbiome like nothing else. And we had a great conversation. I go, what do you do if it's a total mess? You get in there and it's like a weed garden everywhere and there's no flowers. Like you have to burn it all down. So she goes, what we actually do is we will put them on high dose antibiotics, knock off their entire gut microbiome, and then send them out to this guy Matt's farm, and they drink raw milk, and they milk the cows, they ride the horses, they're away from all, there's no chemicals, nothing out there. And she goes, they come back, and she showed me, look at the gut microbiome. They're like, oh my gosh.
That's
Like, so they just
amazing.
restart it, replant it all, or you could do a fecal transplant, obviously. But she goes, yeah, that's how sometimes you have to do it that way. It's just too much damage, and it's hard. But for most of us, you can say, well, let's just, like that's why like William Davis is like what you guys are talking about with fermented foods. Like you don't have to keep buying it over and over. You have it there. And some of those species aren't going to implant, but they go through and they modulate what all the other guys are doing, right, and get them to work better and do what they're supposed to do. So things like kombucha, or may have certain properties that are going to be beneficial, like apple cider vinegar. When people
Mm.
do that helps you make more acetate, which is one of these three short
Yep.
chain fatty acids.
Yep.
So just propionates the other one, but I don't know, like there's not a really good food source, but you let your gut microbiome make it. So that's why I don't see the argument to say you don't need fiber, but your microbiome does
Yeah.
at
Well, and
some
if
point.
you just explain, like you consume the fiber and then it ferments and the colonocytes help make these short chain fatty acids. And I think for so many people, when they understand the net effect of short chain fatty acid production, when it declines, that has huge systemic effects on the body. And I think this is what many people are not talking about. They say the fiber is not important. I have a dog that eats 100% raw food. That dog has no problems pooping every day, every single day. So when
Hmm.
someone makes the argument that, oh, the reason why I don't need to have a bowel movement every day is because I eat a carnivore diet, I'm like, your body's still getting rid of waste. I mean, it's an effective recycling process, hopefully, if it's optimal. I know we didn't talk about the estrobolome, but how our body breaks down and gets rid of estrogen, whether it's endogenous or exogenous. In many women in kind of that perimenopause to menopause transition, they end up recirculating the estrogen, which can magnify all the effects of high estrogen in the body that make women pretty miserable in perimenopause. But it doesn't have to be that case for sure.
It's just it's amazing the dynamics. The more I learn, each one of these levers, right, is something. Metabolics, hormonal treatment, microbiome, chronic toxic exposure. Each one of these, and none of them live in isolation, right? Like, the case I brought up, like it was somebody who was so meticulous about their diet and really otherwise their weight and health, and so meticulous about alcohol and sleep, and yet there was this variable that could not be controlled. And just in my own life, like the chronic exposures, Brian, you've talked about your exposure to mold, right, and the impact that had. And I think we need to put chronic exposures and chronic parasites all in this kind of one bucket of
Hmm.
things that are there, tough to measure, but we all know it, and how to manage it. And sometimes it's just trial and error, right?
Yeah.
Yeah, just having it in the back of your mind to go, you're having a severe mold toxicity. Why? If you have a parasite, it makes it 1,000 times worse,
Yeah.
right? Because your immune response and all this. So you go, huh? So sometimes when you experience it, you see it enough, you go, okay, I know what we can do about it at least, I think you could, I'll use Paul Saladino as an example. He was strict carnivore. He was having health problems, mental health problems. And then he adds in fruits and honey and he gets better and everyone gets mad at him. I'm like, it worked for him. That's like what worked for him. But then, I look and I'm like, how long do I want to live? Like he goes, I put my feet up for 15 minutes, then I go over here in the red light, then I go over here and jump in the cold pool, then I go over here. It's like, you're living your whole life to live longer. Like,
Yeah.
enjoy life a little bit. Like I know he goes surfing and does stuff, but he's like wears gloves when he goes to the store so he doesn't get the ink from the. I'm like, I don't go to the store that often, so I don't worry about that kind of stuff.
Yeah.
But what I'm getting at is you can get to a point where you worry so much about everything and every toxicity that you can't live your life anymore because you're so paranoid, and then your stress hormones and cortisol are all screwed up because you're so worried about what you might get exposed to.
I think you just have to act, right? Like that's the only thing. You just have to act. Like you can't worry about it. Just do something.
Do what you can.
Right?
Do what you can.
Well, I think that's an important kind of reminder that, we can worry about everything, or we can do, I always say the concept of good, better, best, how important that is with patients, because some patients get so worried about they're going to touch a receipt and therefore, that's going to mess up their hormones. And I'm like, listen, it's always like good, better, best, like this prevailing philosophy. We have to be able to live our lives, enjoy time with our loved ones, enjoy what we do for our occupation, but we shouldn't be doing it at the sacrifice of being sane. And I think some people, they're so worried, the orthorexics that are out there, the people that are paranoid to eat anything that's processed, or they're traveling and they're so fearful and worried about eating airport food or eating something outside the house. I mean, there was someone I met, lovely person that I met when I was at an event last year. And this individual indicated that he cannot tolerate staying in a hotel. Every time he flies somewhere for an event, he has to stay in an Airbnb. He buys all his own food. He cooks everything. And I kept thinking, I was like, that has to be really hard to not be able to kind of just enjoy the process of you're eating at a restaurant. Like, if I can find a True Food Kitchen when I'm traveling, I think that's great because I can generally get a fairly clean meal. But by the same token, if I end up eating at a nice restaurant and I get exposed to something I wouldn't normally eat, I don't want to not enjoy the time that I'm spending with colleagues or friends or family members at the expense of my mental health. And I think that's really what we're speaking to is we have to, the good, better, best kind of philosophy, like doing the very best with what we can at that exact moment and letting go of the rest.
That's great advice. And this is a great book, everyone. I would highly recommend it. If you're menopausal, perimenopausal, your wife is perimenopausal, you're going to have a better understanding of what's going on. It's really well done. And you go into a lot into the details of what you can do, not just that there's a problem like, oh, you're stressed, we can't do anything about it. Like there's some great options of how to manage your stress, how to get your sleep right, all these other things that are huge factors in our well-being. Because if you're miserable, you don't want to live forever anyways, right? Like make it a livable life and have fun and enjoy it and go play with your dog and watch the sunset. Unless you have Labradoodles, they're terrible.
One thing I want to say before we head out, and I'd love to say it really. This is about Cynthia Thurlow, but Brian, you can feel the positivity and the gratitude too. I just want to commend, and this is rare, but being curious and a lifelong learner, right? You started as a nurse, you became a nurse practitioner focused on cardiology, you found fasting, became a thought leader on fasting, and you haven't stopped. And I just wanted to take a second and just show gratitude of being a lifelong curious person, going into, certainly hormones and menopause and the gut. I think, each one of these, takes a bit of curiosity and courage, and most people, don't have this. So I just want to say that, when I look at you and I see you, putting out this book and just being the amazing person you are. Makes me happy and I know you're a leader for other nurse practitioners, doctors, anybody, just practitioners in general. This is the model that they really should follow. Somebody who's, a lifelong learner, curious, and willing to just step away from the madness of our insurance-based sick care system. So kudos to you. And Brian, I feel the same way about you.
Yeah, and I'll say the same because, being a nurse practitioner, doctors look down at you. Us being primary care docs are like, well, you're not an endocrinologist. Yeah, but you're doing it wrong. It's not working. Like, to get people to see, maybe it's not working. Let's change paths. And that's why I love that about all of us. We're saying, well, because if you would ask me 4 years ago, I go, carnivore is probably the best low carb diet you can do. And I go, well, maybe look, I'm not seeing that in the numbers sometimes. Sometimes I am, sometimes I'm not. So, individualizing it and just being able to say, have you guys thought about this? And see, you have to have open-minded people go, let me consider that. Tro 2 years ago, if we talked to gut microbiome, he was like, I don't want to hear this. Like, you're wasting my time. He was annoyed with me because this lady was talking about lentils. And he goes, there's so many carbs in lentils. I go, yeah, but it helps the gut microbiome. And if you fix the gut and trust me, I see it. People fix their gut and they eat more carbs now than they ever have. And their A1C is better and their insulin is better. What's our goal? Right.
Yeah.
So anyways, it's just amazing. Like, in 2 years, we may have a totally different conversation and going, what, that lactobacillus stuff that causes this problem. Right. But at least being able to be open minded to say, what do we do to help that person in front of us or ourselves when things aren't working? And so, Cynthia, thank you so much. And this is such an important topic. So I'm glad when I heard you were going to do, I'm like, we got to have you on, talk about this.
Well, thank you, guys. I respect you both so enormously. And, as much as my husband likes to teasingly make fun of me, he's an engineer through and through, undergraduate degree, graduate degree in engineering, works in the energy business, but he always says you're a bigger nerd at heart than I am. I mean, I don't know how else to be. I think for all of us that are just curious, innately curious. I was having a conversation with my 20-year-old who's an engineering student in college, and he was saying, God, I can't wait to be done with college. I don't have to learn anymore. And I said, oh, buddy, you don't realize it's the rest of your life. You want to be a lifelong learner. It's so important because, what's the alternative? To be stagnant and unhappy? And so many of my colleagues from before, many of whom have been incredibly gracious and kind throughout the trajectory of the last 10 years. But just as many of them that were thinking that, I was crazy, just like I'm sure your colleagues thought you were crazy. And yet now they're like, wow, like this is really a phenomenal opportunity for all of us to acknowledge that sometimes we don't know everything. And we have to remain open to the possibility that we may change our minds, and that is totally okay. Like, I want listeners to understand that too, that we are allowed to change our minds. That's actually a sign of being an intelligent person.
Absolutely. Being flexible, neuroplasticity. Right?
Yes.
Could use some more neuroplasticity.
Yeah, neuroplasticity. Yeah, like being able to learn a new language, learn new stuff, go have new experiences. Not play video games all day or watch Judge Judy, even though I love her.
Look,
but no,
guys,
it is really, it's great to have you on, and I'm looking forward to the next book, and we'll bring you back on and talk about that, learn some more from you.
Thanks,
guys. Just so you know, the first book was the Intermittent Fasting Transformation, and this newest book is the Menopause Gut, and the links are in the show notes.
Thanks.
If you enjoy the show, please consider supporting us on Patreon by going to lowcarbmd.com.